Welcome back again, friends. I'm Dr. Chinchi Adebago, your trusted global public oral health advocate. Back again on the Body Mouth Connection channel, where we explore how oral health affects your overall well-being. In our last episode, we learned what causes bad breath. Today, we are talking solutions. The exciting news is that bad breath can be manageable once you treat the cause, not just cover the smell. First, let's learn how to assess for bad breath, because nobody might be comfortable enough to let you know you have bad breath. But sometimes you want to self-assess so you can at least help yourself. Now, the spoon test, one of the best spoon tests. Use a clean spoon. Gently scrape the back of your tongue. Wait about 5 to 10 seconds, then smell the residue on the spoon. If it smells foul, then you need help. Number 2, use a piece of dental floss and floss the back of your teeth, especially where food tends to get trapped. Smell the used floss. If it has a strong odor, plaque, food debris, or gum disease might be present in that area. Now look at the tongue. A healthy tongue generally is pink, or at least very thin like coat. If there's a thick white, yellow, or brown coating, especially towards the back of the tongue, it's often an indication of a buildup of bacteria that could contribute to bad breath. A lot of people are familiar with this one, the cup test. Cup your hands tightly around your nose and mouth. Exhale through the mouth, then immediately inhale through the nose. This can sometimes help you detect an odor, but it's not really as reliable because sometimes your nose could trick you. The easiest way, ask someone you trust. Honest assessment would almost come from someone as close as a spouse, a close friend, a sibling, mom, dad, or family member. Then find the source. Don't just buy mouthwash. Find out why. Time to visit the dentist. If you haven't done that, find a good dentist. Don't wait till you have the money. Make that a value. Prioritize that. Comprehensive exam that includes gum assessment with x-rays will be needed. Brush correctly. Brush 2 times every day for at least 3 minutes. Use a soft bristle toothbrush. Be sure to replace your toothbrush 3 to 4 times every year. Or sometimes your toothbrush will talk to you when the bristles are all over. You don't have to wait 3 to 4 months. If you brush aggressively, then it's time to change when your toothbrush tells you to change it. Floss daily. Flossing is not just for when you have food in between your teeth. It's actually part of your daily routine. On one of our episodes or series, we'll talk about how to brush correctly, the right angulation, and how to floss correctly. Brush your tongue. Use either your brush or a tongue scraper. Most times, you'll feel like you're about to throw up. It's okay until you get comfortable with it. And you'll find yourself doing that. It's time to get yourself a tongue scraper. Tongue scrapers would actually do the magic for you. Stay hydrated. Drink water throughout the day if you feel your mouth is dry. Saliva is your body's natural mouthwash. Sugar-free bubble gum sometimes would help. Make sure you're reading or looking for one that contains xylitol. Treating gum disease is very important. If your gums bleed, please do not ignore it. Professional periodontal treatment removes bacteria below the gum line. When your gums bleed, it's never okay. What baffles me most is when people scratch their scalp and they feel something is odd or they have bleeding. They are worried about it. When you brush your teeth and you spit out blood, why are you not concerned? There are really some food that might help you with gum disease, or rather keep your mouth clean. Food like apple, carrot, celery, cucumbers, leafy vegetables. They can freshen your breath. There are some food that can make your breath worse. Garlic, onions, alcohol, smoking, coffee, sugary snacks. High protein diets without proper oral hygiene. Good hygiene is key. Drinking water is key. Seeing your dentist is key. When it comes to toothpaste, look for fluoride toothpaste with antibacterial ingredients. Good examples would be the Colgate Total, Crest Pro Oral Health, Parodontax. That's especially good when your gums bleed. It will not, hear me again, it's not treating your bleeding gums. You still need to see your dentist to treat bleeding gums. When it comes to your mouthwash, please be on the lookout. Look for alcohol-free mouthwash, especially when your mouth is dry all the time. And keep an eye for ingredients like zinc compounds or chlorine dioxide. Avoid alcohol-based mouthwashes. It tends to worsen the problem. We already talked about tongue scraping. They are very inexpensive and very highly effective. So consider getting one and adding that to your tools in the morning. Xylitol bubble gums or xylitol mint. These have a tendency to stimulate saliva and reduce cavity-causing bacteria. Dry mouth products if needed. Biotin oral rings, biotin gel, Act dry mouth rings. These are all good. At least we've used them and people have a lot to say about them as well. Things to avoid: smoking and vaping, keeping brushing and flossing. That's not a good idea. Brushing your teeth without brushing your tongue. Using mouthwash to hide the odor. That's not a good thing. Get to the root cause of the problem, which most times is gum disease. Believing gum disease is normal, or even the belief that bleeding gums are okay. What bad breath could signal could be more serious than you think. If your breath persists despite excellent oral care, please consult your dentist or even a physician, somebody who knows better. There might be some chronic situations like sinus infection, tonsil stones, uncontrolled diabetes, in some rare cases, kidney disease. So be sure that when you've done everything you're supposed to do, which is you've seen your dentist, you've brushed, you've flossed, you're using the right mouthwash, you've stopped smoking, and you've minimized on all the things that you're not supposed to be doing, and it still persists, please be sure to seek professional help. Here's what I want you to remember. Bad breath is not a character flaw. It's usually a sign that something in your mouth or occasionally your overall health needs attention. In most cases, once the cause is identified and treated, your breath can improve dramatically. Don't hide your smile. Don't avoid conversations. Don't suffer in silence. Fresh breath begins with a healthy mouth and a clean mouth that supports healthier body. If this video helped you in any kind of way, please like, subscribe, and share with someone you care about. You never know whose confidence and health you might change. Until next time, keep smiling, keep taking care of your mouth, because your mouth is the gateway to the whole body. Bye for now.